Hi, I'm Vera. I'm a 4-time survivor and the founder of the nonprofit Breast Cancer Goddess and the for-profit The Cancer Goddess. And I'm here to educate you about spiritual, mental, and physical healing in regards to cancer. So please enjoy this programming. So I'm here with, you want to make sure to look at them.
Hi there.
I'm here with the very profound and prolific Dr. Jennifer Simmons, who recently wrote a book. What's your book called?
The Smart Woman's Guide to Breast Cancer.
And I tried to buy it, but unfortunately she sold out of it. So she'll send me one, right?
Yes,
right?
I absolutely will send you one.
Okay. And this is important because I run a nonprofit for breast cancer support.
Yeah.
So this is important stuff.
What is
the main, takeaway?
Yeah. So the reason that I wrote the book is because when a woman gets diagnosed with breast cancer, she is immediately put on this treadmill going 15 miles an hour, right? Get surgery, get chemotherapy, have your port placed, get radiation, and you're terrified. You're not given the information that you need in order to make a decision. And the decision that you make in that very short period of time affects you for the rest of your life. So you're not given the information to make a proper decision. You don't really understand your diagnosis or what's going on with you. You don't understand the treatments. You don't understand the short and long-term consequences of the treatments. And so before you even know it, you've made these decisions. You don't even know why. You're not sure they were the right decisions for you. And you live with a tremendous amount of regret afterwards. I wanted to stop that in its tracks. I want people to know that, first of all, you have time. Take a breath. You have the time and the space to educate yourself, to learn about what all of this means, to learn what your pathology report means and what it means to you, and to understand what all the different treatments are, the questions that you need to be asking, the questions that need to be answered, because oftentimes we ask the questions and we don't get answers, right? So I'm providing you with all the answers so that you are going in an educated fashion on your terms.
And what's your experience that makes you qualified to do this?
Yeah, so I spent
besides looking just fabulous. I mean, look at this outfit. And you should have seen her the other day, high heels and a fuchsia outfit. I haven't worn high heels in 20 years.
Really?
No.
No, I live in high heels. I've only taken my heels off
You
to go to the airport
more than
today.
one thing. Okay, you gotta teach me how to wear high heels.
But
okay, sorry, go on. What makes you qualified?
I spent 20 years as a breast cancer surgeon, running a breast cancer program at an academic institution, running an NIH accredited cancer program. And I did that for a really long time until I got my own diagnosis. And it was only through the lens of a patient and as a patient that I learned about all of the downfalls and all of the pitfalls of our conventional medical system. Because when faced with my own decisions about surgery and chemotherapy and radiation, I made a different choice for me. Now, I do not disparage anyone who makes a decision to have surgery, to have chemotherapy, to have radiation. We all make the best decision we can with the information that we have at the time. My goal with the Smart Woman's Guide to Breast Cancer was to be able to give women the opportunity to make an educated decision for them. Because there's no one way, there's no one thing. Everyone's situation is different. Everyone's disease is different. What brought them to the table is different. And so everyone's treatment plan needs to be different. And we have to stop putting people in these routine silos and giving them this like standardized assignment and saying, this is what you need to do, because it's not true. And so I wanted to empower women with the information they need to help themselves, because the truth is that I'm a great doctor, but I can't heal you. The only person that can heal you is you.
Yourself. Yeah, it's true. It's true. It's beautiful.
Thank
You're
you.
beautiful.
Thank you.
I love what you're doing. I really do. I really do, because more doctors need to know this. And why do you think there's such a discord there? Like, why aren't more medical professionals doing the work you're doing and educating these women who are suffering and getting cancer and dying?
I know.
One of my good friends, left her kids. They're growing up without a mother, and this was colon cancer. It wasn't breast cancer. I know breast cancer is very treatable now, but my grandmother passed, and very young. I never got to know her. But why?
Colon cancer is very treatable. I mean, they're all treatable, and still there are going to be people who are not cured.
But why? Why is there such a disconnect? Why are
there's
doctors
a huge
still
disconnect, because what we are trained to do as physicians is not to heal. That is not what drives the system. Our system, unfortunately, is driven by illness. It's driven by sickness. It's driven by disease, and it's driven by dysfunction. So at no part in this process, healing isn't even their goal, right? So they are trained to recognize disease and to prescribe a procedure, a treatment, a pill, a drug, an infusion. That's what they're trained to do. And that's what a good doctor is in the conventional medical world.
Can we out this minute? They didn't hear my speech. I mean, I can't.
So, I don't fault them. It's not them trying to be uncaring, but they are caught in a system that they're doing exactly what they're supposed to do, right? They are being good doctors within the confines of that system. It's the system that's broken. And remember, they are paid to give chemotherapy.
Right. That's their paycheck, baby, because there's no paycheck in eating holistic food and fasting.
and there's no paycheck in talking to your patient. There's no paycheck in asking them what's going on with you. What do you think is driving this? How can we improve your life, from the nutrients that you get to your movement to your environment? How can we help you to detoxify? That these are not conversations that they're paid to have. And so it takes someone to be made aware of the possibilities and step outside of the system, right? And most of the time, that only happens when they experience it in a different way. Because otherwise, they're putting their head down and working. They have bills to pay. They have kids to, tuition, and
they
put their
see
kids through school.
many patients, especially now. It's like
so many.
They're burnt out. I mean, they need that help. I mean, there's a lot of suicide and depression and within the field, right?
That's all
so they
true.
need the help. It's like the healer needs the healing the most.
Yeah, they have 50 patients to see every day, and they're under a tremendous amount of pressure to sell, right? I mean, that's what they're doing, and they have to. They have to. So I don't fault them. I fault the system, and I am optimistic now more than ever that we have the opportunity for change. And there are enough loud voices who are out there in the world really making a difference. And
like yourself.
Yeah.
Like this conference.
Yes.
This is my first cancer conference ever.
Really?
Seriously.
Wow.
Seriously.
Wow.
Seriously.
I'm so glad you're here. And I'm so glad we got a chance to meet.
A cancer conference virgin, yeah.
But I'll tell you that we will plan something very soon for over Zoom where we can have a quiet atmosphere and have a long conversation.
I can invite all my goddesses too.
That would be amazing.
Yeah, I have 3,600 right now in my group.
That's terrific.
Yeah, and they're all, most of them are terrified. And they always want to know the nuances of this cancer and this diagnosis and this, blah, 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 blah. I had this as a, it doesn't matter. At this
know.
point, you just gotta treat the soil, not the seed.
I
You gotta
know.
treat the soil, and then
That's
you'll be
exactly
fine.
right.
I don't focus on my diagnosis beyond that they gave it to me, and then I'm done. Now, what do I have to do?
Yes. And unfortunately, it's a lot of unlearning that has to happen because we've been so conditioned to think that the tumor is the problem that we never consider that the tumor is merely the symptom of the problem.
Right. It's your body knocking on your door and
Yes.
saying, hello.
Yes.
Hello.
Yes. That's exactly what's happening. So, but times they are changing.
Yes. As Mr. Dillon said.
Yes. And so I think that this is an amazing time to be a part of this movement. And I know that I in particular, I was put on this earth in order to change the conversation around breast cancer.
You were. Yes,
and
you were.
I am changing it.
Yeah, God. This is how God works. So I agree with you.
For sure.
Sister from another mister. That's what I'm saying. All right. So tell me your book again so we can.
My book is The Smart Woman's Guide to Breast Cancer. And then for
so stupid women can't read it?
Actually. I mean, who I was speaking to is the person that is not taking what they say as the be all end all.
Right.
The person that knows that there's something more and is looking to go find it.
Yeah. That's the smart woman. That's the goddess. The goddess doesn't fuck cancer, doesn't slay cancer, but dances with cancer and learns from the cancer. That's what a goddess is.
Yes, absolutely.
And she's a smart
Without
woman.
question.
And she's a smart, educated woman. And that's why she's going to read your book too.
Yes. And she's just not taking what they have to say as the be all end all. And, you know, I talk about this in my book because we, in the conventional medical world, they use all of this war terminology, fighting, and
very masculine.
And the truth is that we've had enough fighting. And fighting is how we got to that place of imbalance. And so my entire platform is about bringing hope, but more than anything else, restoring the chemistry of joy, because that's what we all need.
Oh my gosh,
we all need more joy.
I'm putting on an event on Sunday. You're invited, of course. Fun heals everything. It's a dance party.
Oh wow, yes, that's so fun.
I'm doing it with a practitioner named Fun Heals Everything, because literally fun can heal everything.
Without question.
Mindset, placebo is more powerful sometimes than medicine.
Yes.
I'm learning
agreed.
this. I work with Dr. Ellen Langer at the Mindfulness Lab at Harvard, and I'm learning so much from her and implementing it into what I do as well. And we're just speaking the same language. So it's really great to speak the same language.
Amazing.
Yeah.
Amazing.
Fun will heal everything. Will you dance with us on Sunday?
I would love to.
Will you be there? Really?
I don't know.
Just say that for the podcast. She's coming, guys.
But I would love to have you on my podcast.
Oh my gosh, I'd be honored.
So I have a podcast called Keeping Abreast with Dr. Jenn. And then for anyone who's looking for help on their breast cancer journey, realhealthmd.com. And I don't work one-on-one with people so much anymore, but I have amazing group programs.
I mean, what else are you doing?
It's just hard.
Your life?
Yeah,
you have a life.
I have amazing group programs for people who are looking for like-minded people to go on the journey with.
What is the group called? We can find it.
So the group is called the Breast Health Blueprint, and everything that I offer is at realhealthmd.com.
And you have training programs and coach?
So I will have a practitioner training program that I'm releasing in October. So I'm very excited about that. I
love coaching programs.
Yeah, I'm doing that along with Dr. Lindsay Berkson. And then I will also have a patient-facing training program too. So
even better for the people who are also with the patients, they can also do the program.
Yes.
Because
Yes, for sure.
They are the advocates.
Yes.
They are the advocates for people who can't be an advocate for themselves.
Without question, without question. And your team and the people that surround you are of the utmost importance. You know, we talked a lot at this conference about what to do when your family doesn't support you, what to do when your community doesn't support you, because again, people have been so conditioned to go down that conventional medical route. But the only person that conventional medical route benefits is the system.
Yeah. Beautiful. Yeah. The last thing I'm going to say, okay, you guys, some of you are just listening to the podcast, don't see how gorgeous and stylish this doctor is. So tell me, how did you get so gorgeous and stylish? And what has it
Thank
been
you.
like?
That's very kind.
then
I don't do compliments well, so
Okay.
this is very hard
Well, flattery
for me
will get you everywhere, right? Okay. So my question is, how have you navigated being a woman that's fabulous in the medical male model like journey?
Yeah. So, and especially having been a surgeon for 20 years and coming through a very male dominated field. But the truth is that everything that I have is from God. Everything I have is from God. And for whatever the reason, God wanted me to be in this exterior. And it has, at times, you know, people question how I can be smart because I'm pretty, right? But for me, it has always fueled me because I walk into any room in a confident way, owning my space, knowing that I am here serving God with great purpose.
She's a deep, deep person, as I mentioned. So thank you,
Thank
doctor.
you.
And
Thank
I look
you.
forward to connecting soon and reading your book and continuing to share it with my community. So
Yeah,
thank you very
me
much.
too.
Thank you for watching or listening to this educational program. Please don't forget to subscribe to this channel and also my Substack, which is at The Cancer Goddess. We will have lots more programming, lots more interviews that will help you enrich your mind, body, and spirit in the face of cancer. Thank you.